Talmage Egan, I'm here to introduce him for his 2016 Lifetime Achievement Award. And Talmage began a fellowship at Stanford in 1990. By the way, sometimes it took a while for ISAP to track him down to let him know this, but at the time they tracked him down, there was a photographer who captured his expression on receiving this award. And Talmage spent 2 years at Stanford. We tried to recruit him to the faculty. We're unable to compete with Utah, but he just did fabulous work. This is one of the very first, this is one of actually 3 papers that together were the very first papers ever published on something that we knew of as GI 87084B, subsequently known as remifentanil. And in this paper, cited 343 times, which shows the kind of impact that Talmage's work has had. The studies that we did were not for the faint of heart. If you take a look at the dosing of remifentanil here in these volunteers, 8 mics per kilogram per minute. These are sizable doses. And Talmage really went from this sort of study, which took some emotional fortitude, to being willing to be tied up in knots by learning non-mem. And that is he became quite expert at population PK/PD. If you take a look at this paper, you can see the full population models. You can see him doing, we didn't know quite what to call it. The context sensitive hadn't been coined yet, so we called it the time for a 50% drop, but it's the kind of modeling that became standard for presenting this sort of work. Talmage continued with looking at things like obesity, and this work has continued in Talmage's life. If you look at here from just 2012, looking at another drug, AZD 3043, again, non-mem modeling, again looking at time for a 50 or an 80% decrease versus propofol. The same kind of high-quality, expert PK/PD analysis plus the clinical interpretation. But he's not just sort of a PK/PD geek. He's done some wonderful work with Ken Johnson here. There's work done on hemorrhagic shock, Ken being one of his proteges. And they published a whole series of papers on hemorrhagic shock, which really led to quite a remarkable observation showing that how much do you have to reduce the drug to get to the same drug effect? Well, with propofol, you can only give 10%. You have to have a 90% reduction to not kill the pig in this model. Remifentanil, not quite as severe, but look at etomidate. It's actually why etomidate kind of works in shock. You can give essentially the same dose and not kill the animal. But Talmage has also gone into things like sedation. I don't know if this was intended as his first sedation paper, but it was the first one that I found with Ken Johnson looking at awake craniotomy. But Talmage has really led the field, created something called safe sedation training. Safe sedation training, Talmage is trying to change how we view sedation training, created a company called MedViz. I don't know if anybody has adopted this. I mean, is this a good program? Well, actually, if you go to the ASA and say, how does the ASA recommend that sedation be taught? And it's Talmage's program. It's MedViz, powered by MedViz. This is Talmage's work in sedation. And he's found time to write a textbook, pharmacology and physiology and anesthesia. But we can't ignore the elephant in the room, as Talmage is trying to do in this photograph, because Talmage is now the chair at the University of Utah, really taking it, I think, to the next level there. And it's interesting, Talmage has skills that you may not appreciate. In the lower left-hand corner, you can see that he speaks Japanese. The talk today will be in English, I understand. And there was a rating scale on the upper right-hand thing of their website, which I found kind of uninterpretable. The final thing about Talmage is in introducing Talmage, life is all about partnerships. We've been partners a long time, but when one has to talk about Talmage, one has to introduce him as part of an unbelievable partnership. So, Talmage, congratulations.